watching Oklahoma's News Channel 4 at 10.
You know, recently we've been following Bob Berry Jr.'s progress after his decision to undergo gastric bypass surgery. His battle to lose weight has prompted a lot of you to call and email us with questions. And one in particular keeps popping up. So tonight, News Channel 4's Meg Alexander tackles a question sent in by a woman from Blanchard. She asks, is it okay for obese children to have weight loss surgery? Tonight, Meg goes straight to the experts to answer that good question.
We hear about adults getting gastric bypass all the time. Have you ever wondered if kids could do it?
You know, I've never really thought about it.
But many are starting to think about it, especially with obesity on the rise in children. Gastric bypass surgery, such as what our own Bob Berry Jr. had, drastically reduces the size of your stomach so you feel full much faster and reduce your calories. We have learned that some children can have the surgery as well.
You really would want to do it when someone has reached their full maturity, relatively about 95% of their predicted adult growth size. You want to make sure the bone plates are finished growing and so forth.
12 would probably be the youngest age, but it's more complicated than that.
With a child, would you worry that they wouldn't be learning the emotional components of eating?
Oh yeah, emotional and just forming good healthy habits.
This mom's right. The child has to be mentally mature as well.
Do they have the cognitive and the social skills to be responsible for the procedure that was done on them?
A risky procedure that for some would make them less at risk.
The longer they have type 2 diabetes, the harder it is for us to reverse that disease or cure that disease.
Broussard says that the lab band surgery may be a better option for some kids because it's reversible, but for many it's also not as effective. If you have a good question you'd like Meg to answer, just log on to KFOR.com, click on the good question icon, or you can email Meg directly at meg.alexander@KFOR.com.